Hi everyone. Today we will be discussing the part 2 of osteology of clavicle. Right? In part 1 we discussed about the important features of the shaft of the clavicle, ends of the clavicle, and the clinical conditions related to the clavicle. Right? In this video I would like to explain number 1, the ossification of clavicle and the attachments associated with the clavicle. Right? Before going to the topic, I would like to revise what we studied in the previous video. It would be very short revision, right? In previous video, we studied that a clavicle is a long bone which is placed horizontally, right? It has the medial two-third convexity and lateral one-third concavity. The medial end is attached with the sternum. The lateral end is attached with the acromion process of scapula, right? And we studied there are some other features of clavicle as well, right? Like the medial end has a subclavian groove, and the impression for costoclavicular ligament. The lateral end had a conoid tubercle and trapezoid line, right? So first of all, we will study the attachments which are associated with the clavicle. Before going into that, I would like to show you the pictures of the real clavicle. So I am using the book BT CHAURASIA. So I will be teaching according to it, right? First of all, the first line is at the lateral end. At the lateral end, the margin of the articular surface for its acromioclavicular joint gives attachment to the joint capsule. Right. This is the acromion process of the scapula, and this is the lateral end of the clavicle. And there is a joint which is called as acromioclavicular joint. And we all know that every joint is surrounded by the a joint capsule, right? So number 1 is clear. Number 2, at the medial end, the margin of the articular surface for the sternum gives attachment to, right, fibrous elevate. Fibrous capsule of sternoclavicular joint all around. Articular disc posterior superiorly, interclavicular ligament superiorly. Now see, the fibrous capsule, we all know that all the joints are covered by the fibrous capsule, or we can say joint capsule, right? So there is nothing new about that. Articular disc, you can see the articular disc, capsule and ligaments are removed anteriorly so that we can see the articular disc. See, this is the articular disc. Third, interclavicular ligament superiorly. See, from one clavicle till second clavicle is the interclavicular ligament, right? And other things which you can appreciate here are anterior sternoclavicular ligament. If they are saying anterior, there is also posterior, but posterior is not visible in this picture, right? Interclavicular ligament, clavicular notch, which articulates with the medial end of clavicle, articular disc. This is the rib 1. And remember, I told you the costal cartilage of the rib 1 and the clavicle. And the ligament is attaching both of them is called as costoclavicular ligament. Right? This is the sternal angle, which is important landmark, also called as angle of Lewis. Right? And attachment site for second rib and manubrium of the sternum. Right? So first point and second point are clear, right? The third point, the lateral one-third of shaft. You know, when we say lateral one-third, this means we are talking about uh, this area, right? The anterior border gives origin to the deltoid muscle. See, this is the deltoid muscle in green color. The anterior border. This is the anterior border. See, This is the anterior border of the lateral one-third of the shaft, uh, at which the deltoid muscle is arising, right? Part B, the posterior border gives insertion to the trapezius muscle, right? And see the posterior border. The posterior border in blue color is giving attachment to the attachment to the trapezius muscle, right? Third, the conoid tubercle and the trapezoid ridge gives attachment to the conoid and trapezoid parts of the coracoclavicular ligament. This I have explained previously as well. I'm repeating it again. The conoid tubercle, the trapezoid line. Both of them are attaching to the coracoid process of scapula. Coracoid process of scapula, and these ligaments together are called as coracoclavicular ligament. Right? Right. Now moving towards the medial two-third of the shaft. Most of the anterior surface gives origin to the pectoralis major muscle. See, the anterior border, or you can say the anterior surface, is giving the attachment for the pectoralis major muscle, which is a red color muscle, right? Next, half of the rough superior surface gives origin to the clavicular head of the sternocleidomastoid muscle. Now see, this whole muscle is a sternocleidomastoid, right? It has two parts. One is the clavicular part and the other is the sternal part. The sternal part is attaching on the manubrium. The clavicular part is present on the superior surface of the clavicle, right? Third, the oval impression on the inferior surface of the medial end gives attachment to the costoclavicular ligament. Now see, I previously taught you that if this is the clavicle and this is the first rib, see, this is the clavicle, this is the first rib, right? From the costocarpate of the first rib to the inferior surface of the clavicle, there is a ligament. It is called as costoclavicular ligament, right? Next, the subclavian groove gives insertion to the subclavius muscle. The margins of the groove give attachment to the clavipectoral fascia. Okay. If you zoom it and see it a bit clear, not red, blue. See, this is the inferior surface of the clavicle, and there's the muscle. They see this muscle. It is called as subclavius muscle. It is present in the groove of the clavicle. Sorry, subclavian. It is present in the subclavian groove, right? And it is also a site of clavipectoral fascia. Fascia are the sheets of tissues like which cover the muscles, which separates the bundles of muscles, right? And next, the posterior surface close to the medial end gives origin to the sternohyoid muscle. Now they are saying, this muscle was not present in the picture. I myself tried to draw it like this. See, they are saying that on the medial end, right? On this end, medial end and the posterior surface, right? And there is a muscle which is arising here. This is called as sternohyoid muscle. Means arising from the hyoid bone till the sternum. Like not sternum, a bit close to the sternum, right? Some part on clavicle and some part on the manubrium, right? This is the sternohyoid muscle. Okay, sternohyoid muscle is attached on the medial end of the clavicle and some part, I think, on the manubrium as well. That is why we are calling it as sternohyoid. Okay. Next, the subclavian vessels and the division on the trunk of the brachial plexus passes towards the axilla, lying between the inferior surface of the clavicle. I told you in previous video, and the nerves, arteries, veins. They are protected by the clavicle. How? They pass underneath the clavicle, between the inferior surface of the clavicle and the superior surface of the first rib. And on the above, they also have the subclavius muscle, which provides as a soft pillow, right? The nutrient foramen transmits a branch of the suprascapular artery. I'll explain nutrient foramen later, right? Nutrient foramen is a foramen which is present in the inside the bone, like on the surface of the bone, right? Through this bone, the artery enter the bone to supply the bone, because bone is a living tissue. It needs nutrients, right? The clavicle bone is supplied by the suprascapular artery, and suprascapular artery is a branch of thyrocervical trunk, which in turn is a branch of subclavian artery. Let me show you. See this picture? Subclavian artery. Let me draw it. See, this is the subclavian artery, right? From subclavian artery, there is the thyrocervical trunk. I have made some. I have changed color so that it would be easy for you to see. Right now, see, this is the subclavian artery, and it's giving a branch. It is called as thyrocervical trunk, and from thyrocervical trunk, an artery is coming out. It is called as suprascapular artery. Right. So this was all about the attachment associated with the clavicle. We can revise it, right? Like if we studying the lateral 1/3 of the shaft, we have two muscles: anteriorly deltoid, posteriorly trapezius. Anteriorly deltoid, posteriorly trapezius. And we studied previously, there is the costoclavicular ligament, right? Attaching on the not costo, the coracoclavicular ligament, right, which had two parts, the conoid tubercle and a trapezoid line, right, arising from them. Then the features of the medial 2/3 are pectoralis, anteriorly pectoralis major, right, superiorly sternocleidomastoid, the clavicular head or the sternocleidomastoid, right, and number 3 was this sternohyoid, right? Sternohyoid is arising from the medial end of the clavicle, right? And some part of the manubrium as well. Okay. And then subclavius muscle in blue color, right? And costoclavicular ligament, which I showed you, between the first rib, costal cartilage, and the inferior surface of the clavicle, right? And the last one was the nutrient foramen, which is being supplied by suprascapular artery, right? Now we will move towards the ossification points. This is another picture showing the clavicle and first rib and the subclavian vein, subclavian artery being between the inferior surface of the clavicle and superior surface of the first rib. Now see ossification, right? Whenever we say that the primary ossification center and secondary ossification center, please keep in mind that if this is a bone, right, the primary ossification center arises here, right, and second in the shaft, and secondary ossification center is always at the epiphysis, that like here. Okay, now see, the clavicle is the first bone in the body to ossify, right? Means that this is the first bone which is being formed in the body. Except for its medial end, it ossifies in the membrane. Now see, now let me explain. There are two types of ossification, for which I will make another video. Well, it is a detailed process, right? There are two types of ossification. One is membranous ossification, and the other is endochondral ossification. Right now, I can give you a brief view that membranous ossification is, first of all, the mesenchymal cells come, right? These are the mesenchymal cells are the cells which are responsible for making different types of cells like osteocyte, osteoblast, osteoclast, right? They come, arrange themselves, and then they form the bone, right? Endochondral ossification is there is first the chondrocyte. There is the first plate of hyaline cartilage, right? Like we can say a frame of cartilage, which after a series of process then forms the mature bone, which is composed of osteocyte, right? Whereas in hyaline cartilage, the cells are made up of chondrocytes. Okay. So they are saying, except for its medial end, this means that the medial end, the medial end, it may ossify, it ossifies through the endochondral ossification, where except for its medial end, it ossifies in the membrane. This means medial end ossifies in the endochondral, where the remaining part of the clavicle ossified by the membranous ossification. If you want me to make video on the membranous and endochondral ossification, do comment, right? Next, the two primary centers appear in the shaft. Shaft is here, right? Shaft between the 5th and 6th week of intrauterine life. Intrauterine life means during the pregnancy, right? When the baby is inside the mother, right? They appear in 5th to 6th day and they fuse about 45th day. Now see the 5th and 6th week, right? 5th and 6th week, they mean to say that a center appeared. That means that there is a cluster of the bone cells, bone forming cells, which appear in the 5th and 6th week. They form the bones, they continue replicating, mitosis, increase in growth. But as they reach the 45th day, the 45th day of pregnancy is actually the 7th week. 7th week, this center closes. Now the bone growth has stopped. Okay. Similarly, the secondary center for the medial end appears during the 15 to 17 years. Means during 15 to 17 years is the we can say that from the age of 13 to 15, there's a growth spurt in the young person, right? The body, the bones, the muscles, and everything is like growing, right? So at that moment, this appears, secondary center, and it fuses with the shaft during 21 to 22 years, right? So now secondary center, I told you secondary center appears in the ends, like in the epiphysis, like in the humerus, there will be epiphysis, right? Epiphysis is not the long bone. In clavicle, it only appears at the medial end, right? Occasionally, there might be secondary center for the acromial end. They're saying that there might be secondary center in the acromial end, but they're not sure about that, right? And remember, 21 and 2 years means at the age of 21 and 2 years, the secondary center is also closed. That means after that, the clavicle won't be growing. But there's a difference between the growing and between the repair. Like if my clavicle is fractured, my bone is a living tissue. It would repair itself, but it would be taking very long time, right? Whereas growing is the clavicle has some cells which are replicating and then it is growing. I hope you're not confusing it, right? So this was all about the ossification and the attachment associated with the clavicle. If you want a detail, at this level, it's enough. But if you want to know the detail of the ossification, the membranous ossification and endochondral ossification, do comment down. Only then I will make video on that topic, right? Because that topic is a part of histology of bone, right? And take care and Allah Hafiz.